Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
I got it.
Yeah, I would tell the doctor, well, what can I do to get my A1C down?
And I've been told that, but for a couple of years, you're pre-diabetic. But what does pre-diabetic mean? Because I've never been told I'm a diabetic. So I'm sure it's in the numbers. Do I eat differently or what should I do?
Stop all sugar and starches.
Any other ideas of what you do?
Well, normally exercise is everything. So is exercise one of the things? Every time you talk, exercise.
Well, I think one of the, you're right, pre-diabetes is a chemical determination as a consequence of either your hemoglobin A1C being at the level that's close to diabetes, but it's not diabetes. It means that you're likely to develop diabetes if you continue your current lifestyle. And it has more applicability to those people who are in their 40s and 50s than it does to those people who are in their 70s, because although what Carol advised is correct, that you could cut back on your sugars and carbohydrates, and of course increase your exercise. But it is unlikely if you're over the age of 70, if you're pre-diabetic, that you're going to develop diabetes. And that's not true if you're 40 or 50. But if you're 70, it's unlikely that you'll develop diabetes. But it's still a good idea to do what Carol suggested, which is cut back on your sugars.
What's a good A1C number? I'm having a physical.
Below 6.
What is it? Below 6?
Yes.
I'm 5.9.
That's below 6.
I think I'm 6 something.
Oh. You probably
I guess
are.
that's why they're telling me I'm pre-diabetic. Huh?
No, because the above 6 is usually diabetic, but below 6 is.
Dr. Callender, they had me going back and forth. You're pre-diabetic. And then this doctor would say, no, you're diabetic. And this one say, no, you're pre-diabetic. So I said, I'm diabetic. He asked me, I said I was diabetic. So everybody got on the same page.
Okay. Well, what's in the name? But pre-diabetes is not diabetes.
So,
It means that you're likely to develop diabetes if you continue the same practices.
if you're diabetic, Mary Ellen, what do you do differently?
I stopped eating processed food, and I stopped eating bread and drinking sodas and fruit juice.
Yeah,
and I stopped eating hamburger, and I only eat now I do exceptions, like if I go away or if I get treated to lunch, or I cheat on those times, but I pretty much eat the same thing every day, all other times.
Yeah, I'd exercise that, and that's about it. Yeah. Okay. All right, John, you can start the show.
Hey, Kevin.
Hey, good morning.
Good morning.
Welcome back. Welcome back, Kevin. We missed you.
Thank you, miss y'all.
Meanings. As a noun, it means a large solid piece of hard material, especially rock, stone, or wood.
Yeah, there's an article we put in there to let you see what has happened through the decades. This walked in a person of color walked in the room to speak to the young patient, and she asked, "Are you here to transport me to the operating room?" But that's not unusual, especially if you're in places where they don't have a lot of people of color. Yeah, so through the years, it's been interesting to watch how people have changed. But in early days, of course, in my case, they said I was too young. But the other thing was the color of my skin. But over time, things have evolved and things have gotten better. But the reason that it becomes an issue is because the data suggests that if you're taken care of by people who look like you tend to do better. So yes, times have changed, but still barriers. But they're less barriers, but they are there nonetheless. You know, just because you're paranoid doesn't mean that people aren't after you. So I think in many cases, if you're Black, it's kind of healthy to be paranoid. Of course, as you look across the country, white people think race is not an issue. Ethnicity is not an issue. And Black people recognize, of course it is. But this is something, and as we recognize that there's a majority-minority health disparity, which we want to decrease rather than increase, it becomes important to understand that you want to be taking care of a physician who cares and who's knowledgeable. Not what complexion they are, but and nowadays with the amount of information that is shared all over the place, it's really a matter of whether you care enough to get the information to help your patients. And you see these three things: find role models, prepare for injustice, advocate for yourself. And that's the beginning of things that you need to do. Of course, the other thing you have to do is to be true to yourself and stand up for what's right in the face of injustice. Any other comments?
Yeah, are there any mentoring programs that
Many.
black physicians can use to, like, say, recruit high school students?
Many
Okay.
mentoring programs. For example, Howard University and Meharry have middle schools associated with them. And then, of course, we go to colleges and high schools. Okay, next one. Let's go to the next one. This is interesting because it's amazing that even though we recommend 150 minutes, that even 10 minutes helps. So that exercise, to whatever extent you can do, improves your health, your mental well-being, and fitness. So even though you can't do 150 minutes, if you can't, even 10 minutes will help. So any exercise is better than none at all. I think that's the essence of this, and it shows that brisk 10-minute workouts make a difference. And it also talks about the intense physical activity is beneficial, as well as intense, less intense physical activity. They're both useful. So there isn't too short a time for you to do exercise. I think there's evidence that if you do exceed more than 3 to 4 times the recommended time, it doesn't really help much. So the moral of the story is, even if you do 20 minutes a day, it's better than no minutes a day. And it's one thing for us to talk about it. It's another thing for us to do it. So the more we do it, the better off we are. Yeah. And you can start in small 10-minute, and then keep increasing it until you get up to the 150-minute minimum. And it's also interesting what it does to the brain and your cognitive ability as well. Any other comments about exercise?
Yeah, I was telling Joyce this morning, I've gotten into a regular swim routine. Oh, somebody's making noise. They could mute, that would help. So I go 3 times a week and I swim for about 2 hours each time. And I've gotten down to 189. I haven't seen 189 in probably 10 years. So I'm really happy. This time last year I was 205.
Wonderful.
So,
Wonderful.
but I was walking. I started walking, and I wasn't really seeing any weight loss. I felt good. It was good for my spirit, but the swimming is more, and treading water, and also do snorkeling at the different times, 20 minutes of each. And I've noticed that I still have to watch my diet. When I exercise like that, I want to come home and eat. That's the first thing I do. I want to come home and eat right away. And I don't think that's not healthy, as healthy as maybe moderating my eating habits. So
It's interesting that you would say that, because they have an article in the Washington Post about eating the right foods for exercise, and they talk about before a workout, you don't need to eat anything, but after a workout, you definitely need to eat, because you don't want to lose your muscle. So those who exercise, it is okay to eat after you exercise. And, of course, eating the right vegetables and fruits and other things still is important.
And you also need to eat within 90 minutes after finishing a hard workout.
Right, absolutely, right. Now, this is nothing new to us, but anyway, it's something we've talked about for a while. Sugar sweetened beverages are linked to colon cancer mortality. And they've done research to show the link. While links don't establish things, they certainly, and most of the studies are retrospective, they still point out to the fact that sugar sweetened beverages represent the largest source of added sugar, and they contribute to colorectal cancer as well as to arteriosclerosis. And just this points out how the fructose may enhance the tumor growth in the intestines. Of course, if you're getting your colonoscopies, then this then becomes less of an issue, but it's still something to keep in mind. And it goes back to something we've talked about for some time, the fact that sugar and salt are things that we partake of, but they're things that hurt us in the long run. I think that most people recognize that after the age of 40, you need to get a colonoscopy every 10 years if you don't have, if you don't find any tumors. The only place where there's an issue is when you get over 70, whether you need to continue to get that. And most of the recommendations are that you should still probably do it every 10 years. When you get to 90, it's still less, but that's if you want to live to be 100, then you probably could get a colonoscopy, but that's the age at which some people begin to wonder whether it's necessary or not. But up until 90, you probably need to get colonoscopy every 10 years.
Dr. Callender, if during the colonoscopy they find polyps, is that recommended that you get a colonoscopy before 10 years?
Every 5 years.
Every 5 years. Okay.
If they find a polyp, every 5 years. Without polyps, it's 10 years.
Okay.
This is an interesting article because it helps those people who are not BMIs of 25 like Darryl.
No, my BMI is 21.
Sorry, Darryl. But many people, when they have that big pot belly, feel they failed, and there are so many reasons why that's not necessarily the case. But this is a medical perspective. This is a lady who had her bariatric surgery and lost weight, and it kept coming back. And as you know, shaming because of obesity is common. It happens in the health profession, and it happens outside of the health profession. And so a lot of the people get depressed, and they blame themselves for it, even if they are not eating that much, because some people, because of their low basal metabolism rate, gain weight without eating a whole lot. And so they're still not going to tell you that it's healthy to be overweight, but it just says that when you're giving it your best shot, that's all you can do. It's interesting to find that obesity is often an inflammatory process. I know in our studies that we did, we found the biochemical correlates of the inflammatory process that's associated with obesity. And it's interesting, they say that more than 4 in 10 meet the criteria for obesity. To me, that's a low figure, but because I think probably 50% of the people we see are overweight. And what does overweight mean? Usually it means a BMI of greater than 30. Between 25 and 30, you're overweight. 30, you're obese, and above. And 40, you're morbidly obese. Yeah. So, and there's a stigma associated with being overweight, and many times the basal metabolism rate is the problem. But
Sometimes
Which-
losing weight isn't as easy as you think. I have a sister. I would say she's obese. She would slap me if she heard me say that. And she needs hip replacement surgery. And she went to the doctor, to the surgeon, and he said normally he does his surgeries at Doctor's Hospital. And Doctor's Hospital has this staunch rule about BMI. And he's suggesting that she lose 15 pounds before she has the surgery. And so she said, I can do that. And she's thinking she's going to have this surgery in September. And it's been about a month. And she thinks she's lost 4 pounds, but she's suffering. A lot of pain, can barely walk, too proud to use a cane. And the other option, he said, was to go to another doctor and get B12 shots. And she could lose the 15 pounds that way, and then he'll do the surgery. Or he would recommend that she see another doctor. He would give her another referral. She likes this doctor, wants to stay with him. I talked to her about it yesterday, and I said, you can't keep doing this. There's no way, I think, she's going to be able to lose the 15 pounds. And with her weight, I would think it should be a little bit more than 15. But then again, I don't know what's a good weight or bad weight for surgery. The problem is she hurts too bad to be active, and she's trying to modify her diet. But 15 pounds, it's hard for some people.
You're correct. That's right.
Yeah, it's easier said than done. Yeah.
Yeah.
So her options aren't great, but I say find another doctor. So.
Yeah. Well, that's interesting. As you say, you don't know how much you weigh. So.
No.
Yeah. Losing 15 pounds is not.
It's easy for some.
But it's not a lot of weight either. So
No.
makes you wonder.
Exactly. I don't know how, if you're overweight, I would think that 15 pounds wouldn't cause a change in your BMI, but I don't know.
No, I wouldn't either.
Right.
And you're right about exercise. As Buchanan had said, exercise doesn't necessarily lead to weight loss because it has to do with the amount you eat and the amount you burn up. Mm-hmm. And your BMI has something to do with that.
Yeah.
Doctor, is it easier for men to lose weight than women?
I don't know that there's a difference. I don't know that there's a difference. Anybody have any ideas about that?
Thinking about what Janice said, I had a friend who needed knee replacement, and she's almost 300 pounds, and the doctor told her she had to lose 50 pounds. And she tried and tried and tried, and after a while, she just said, forget it. So she's still suffering.
Dr. Callender, my guess would be that it's harder for women to lose weight than men. And that's because after women get past their birthing years, sometimes that baby fat never goes away.
That's the Tatum hypothesis.
Good morning, Dr. Callender. Isn't it something about ladies have more water weight than men?
Yeah, of course that doesn't
Because I remember
doesn't answer the question. That's true, but that doesn't answer the question of who can lose weight easier, men or women. I haven't read anything that identifies that there's a difference, gender difference. Maybe there is, but I'm not aware of it.
I haven't read anything about the difference, but I do know my grandmother used to talk about to my father because it was a total of 8 of us. And she kept saying, with those girls, make sure you watch out for that water weight and make sure that you always, when they get a certain age, they have to include ginger in their diet. And I say for anyone that's trying to lose weight, you need a wellness plan. And that wellness plan is going to cover all those areas. And sometimes you just can't do it by yourself. You need a wellness plan. And because you have to look at your nutrition, you have to look at the water, you have to look at your exercise, you have to look at your stress, you have to look at your sleep. And with your nutrition, you got to see, is your nutrition giving you all the vitamins, minerals, and nutrients that your body needs? So it's an overall plan that you have to look at it. And some people just can't do it by themselves. They need support, they need resources, and that's where people like me come in and other people come in.
Does ginger
That's
help
good.
with
I
weight
agree.
loss? Does ginger help with weight loss?
Not that I know of. I haven't seen it in the research. Ginger has another purpose.
Okay, so this is an interesting problem that many people face, and it's you know, here's the issue. You can have bariatric surgery, which will definitely cause you to lose weight. Of course, that's another surgery. But that will get you to lose 50 pounds or so. But that's surgery. So question
Dr.
is,
Callender, I'm sorry.
yes.
I had 2 friends that had that bariatric surgery. One was about 350. He lost 100 pounds, and a year later he died. Another guy was 400 pounds. He lost 200 pounds, and I think he was able to keep it off, but he looked like an entirely different person. So, but even with that surgery, you have to change your lifestyle, or you just put it back
Yes,
on.
because even with calories, you know, you have to look at how many calories you're intaking, and every person is different. Every body is different. It's based on a variety of factors. Calories need to be calculated based on your height, your weight, your age, your gender. And you have to look at your resting metabolic rate and determine the number of calories you need. Even if you lie down on the couch and do nothing, you know, if you do nothing, you don't need as many calories as a person like me who exercise every day, or who do gardening, or who keep getting grandkids and walk and be active with. So there's a lot of factors, and you have to look at that. A person with no exercise, you don't need as much food as a person who do 1 to 3 day exercise. And there's a rate that determine that. And those are all the factors. And for people like Darryl and my brother, my son, you know, they exercise heavy. And my nephew, they exercise heavy. They're into that. My son is into that heavy training, you know. So I have a plan that I created just for him. His plan is different from my nephew. So everybody's body is different.
You know, John Buchanan, that guy you were talking about that was 400 pounds and he got the bariatric surgery, came down to 200 pounds. And you said he looked different. I bet you he did, because he was 2 people before.
He lost half of his body.
I
Yeah,
know
when-
somebody
when
that
I
had
did-
bariatric surgery and they had terrible after effects. One girl lost her hair, and the other one became incontinent for both functions.
Yeah, they're side effects and complications of everything. So
Yeah. When I was
and we've
doing my
seen-
most intense exercise, I was at 205. Now I'm not at that level, but I'm at 165. And the difference is diet. You go anywhere else in the world, you look at people, most people around the world are not overweight. But most people in America are overweight. It's because our diet. If you stay with, it's called SAD, Standard American Diet. You stay with that, chances are you're going to be overweight. It takes a major diet change. You got to get away from what we generally do in America to have a decent BMI.
Okay, I think everyone has stated well what is involved. It's not easy to change your diet after you've been eating the wrong way for 50 years, but it lengthens your life. So now this is an article that talks about things you age your brain by 3 years according to the new research done on predominantly white people. And that's one of the shortcomings of many of the studies is that they deal with a lot of men and they deal with not many people of color. But it's pretty clear now that there are eight lifestyle factors that not only improve your health, but they also reduce the likelihood of dementia. And this lists the lifestyle factors that smoking, of course, hypertension, diabetes, depression, alcohol and substance abuse, hearing loss, an education level less than a high school diploma, and traumatic brain injury. So these are the factors, and so the ones that you can do something about. You can treat your blood pressure. You can stop smoking. You can you can normalize your diabetes, your blood sugars, depression, take antidepressants, hearing loss. And one thing that most people don't, go back up, please. Go back up. One thing that most people don't, we know that there's a link between hearing loss and dementia, but we haven't really understood whether if you treat that hearing loss, whether your incidence of Alzheimer's is decreased as a consequence of it. But we do know that hearing loss is associated with it.
Dr. Callender, I have a question. You know, hypertension is on that list. And so why don't they ever talk about unchecked hypertension as opposed to just plain hypertension?
What does it matter if you have hypertension? If it's treated, then you don't have hypertension. But if you have hypertension, then now the reason I say that is because a lot of people, you know, we do screening, and the group of people that have the highest blood pressure is those people who are allegedly supposed to be treated, but they're not taking their medications half the time. So that's why. So the issue is your blood pressure normalized? That's the issue, not whether you are taking medication for it, but is your blood pressure normalized? If you're diabetic, is your hemoglobin A1C in the range of 6 or thereabouts?
Yeah, so then if you're taking blood pressure medicine and your hypertension is well controlled, and they ask you, do you have hypertension? What do you think?
You say, yes, but it's controlled by medication, and my blood pressure is whatever it is. Tell them what it is. And if your blood pressure is in the range of 120 to 130 over 80 to 90, then you're controlled.
Dr. Callender, where it says seek treatment for depression or alcohol or substance abuse. What is I know this sounds silly, but what is the best type of doctor to go to seek treatment for depression or alcohol substance abuse?
They have substance abuse doctors, and they also have, for depression, they have psychiatrists or psychologists.
But since stigma is so much in the United States is against psychiatrists or psychologists.
Against which one?
The stigma against going to mental health
Oh,
you know, and
well,
someone.
we got to get over that stigma because it's killing us. So you're right. There's a stigma, but you got to get over it because we have so much depression and we have so much substance abuse that we can't allow that stigma to continue to kill us.
It's making us go crazy.
And
Doctor, one of the things is if you report that you have mental health problems, then a lot of times people lose their jobs or
Not
lose their.
really.
I
Well,
think,
I'm not
I
sure.
I've
think that's
known that to
old.
happen, Doc.
I think that's old. I know too many people now that
That,
seek
that
help
probably is
for
old
depression.
because I'm old.
Yeah, but that's no longer the case.
Yeah, that's taboo. That's old, the idea. And you're right. They used to, especially in your work environment.
Right.
And years ago, I knew of people who sought help for depression and possible mental illness. And well, I'm not going to put it on my insurance because it might track back to my job. But now it's almost standard. I know of many people that say, I need somebody to talk to. And they do it, and generally they get relief from it or get some sort of satisfaction from it. So I don't think it's as taboo as it once was. I think many people seek help.
And the more, the better. It's a stigma that we need to eliminate because, as you said, it is killing us because depression results in too many suicides and of course, alcohol causes depression, substance abuse, the same thing. So, yeah, you're right. There's a stigma, but we're paying the price for that stigma.
what
Dr.
about,
Callender, I had a question with John Tatum about the hypertension. Yeah, in order to dive, I have to have a physical every year, and one of the questions on that exam one of the questions is, do you have hypertension? So, and it's the same question that he asked. Do I say no, I don't have it because my pressure is normalized from taking medicine?
Yeah, that's the right answer.
Okay. Just check.
what about, remember we had just say no to drugs and that was supposed to work and it didn't work. Now this thing right here, stop smoking. It sounds like it's so easy to say stop smoking. So you see someone smoking, where do you tell them to go seek help? Because they could
Probably
physically,
a psychologist or psychiatrist.
okay, and not a medical doctor.
No. But most the people who treat smoking are usually psychologists or psychiatrists. Hypnosis and other ways of treating that have been effective, and even acupuncture. So,
Okay,
yeah,
'cause we had a niece that we were just saying, stop smoking, stop smoking.
that doesn't do it.
But it didn't do it. And we
No.
didn't know how to tell her, take that patch, do this and do that without seeking professional help. And I realized that later.
There's a organization in DC. It's an 800 number that they have all different kinds of things. They even give free patches and all those things away. I smoked for 40 years and stopped when I took medication, Wellbutrin.
Right.
And it's been 10 years since I did that. At that time, I couldn't get Wellbutrin. They wouldn't give it to me for stopping smoking. I had to lie and say I was depressed.
Right.
And I had to see a psychiatrist and he prescribed it, but it worked. But they have resources from some of those lawsuits with the tobacco companies that they can help people to stop smoking. They've got a few little plans and things, but you have to get smoking out of your head. It's easy to get it out of your bloodstream, but you have to get it out of your head. Once you get it out of your head, you can stop, but it's difficult.
Yeah, most people I know have to hit a painful situation in their life in order to even want to stop, like getting sick or really. I smoked for 25 years, and I had bronchitis, and it was really really bad, and I was still smoking. So that was my bottom. It was painful enough to make me want to stop. So most people that I know who actually stop come to that conclusion that this is bad, and it's, I want to make a change. Other people telling you doesn't help at all. You have to realize for yourself that this is something that you don't want, and then you can get help.
Okay. I'm glad you brought that up, because some people think that just say no is enough, but smoking is a habit that is tough to break. Just like nicotine is a habit, it's like alcohol and
Addiction.
other substance abuses. Yes, it's an addiction, right?
Absolutely.
There's an interesting article that talks about eating potassium-rich foods like bananas, avocados, and salmon to reduce the negative effects of salt. We talked about sugar already. Now we're talking about salts and how potassium helps you eliminate sodium in the urine, and helps keep your pressure down, and also is healthy for you. As a matter of fact, while potassium lowers the blood pressure, it also, at high levels, will kill you. So you have to understand that there's a balance with everything. But the amount of potassium in bananas and avocado and salmon, especially if you have normal kidneys, is not enough to poison you.
So, Dr. Callender, why is it just women?
It isn't just women. It's just that they have chosen women because when we talk about heart disease, I guess women have suffered more. And I guess it's sometimes harder to make the diagnosis in women because it presents itself a little differently in women than it does in men. And they did this also because people talk about limiting the sodium, but they don't talk about the other option, which is increasing the potassium.
I don't know if this is true, so someone can tell me. I saw it on Facebook, which I know I shouldn't have read, but they said that green bananas are better for you than yellow bananas. Is that true?
I don't know.
Anybody knows?
I recall reading an article which talked about the different merits of green versus yellow bananas, but I didn't see anything that said one is better than the other.
They said yellow bananas had more sugar in it than green bananas.
I have a sister who went to the doctor recently, and the doctor told her that eat bananas, but don't eat yellow, eat green. So
but you got three colors. You got yellow, you got green, yellow, and darker. Okay, the darker the banana, according to what I've read, the darker the banana, the more sugar there is.
When you talk about that, but I think green is dark to me. So, but that has, and it's true that the greener the banana, the less sugar you have, and the yellow, and it goes from, in many ways, it goes from green to yellow to black. So, and when you talk about darkness, I think that's what you're referring to, going towards the black, because that means more sugar.
I just did a Google search on what color bananas is the healthiest. The greenest bananas are the most beneficial to those who are trying to keep control over their blood sugar levels. Green bananas are extremely low in glycemic index, making them an ideal snack for those who want to keep their blood sugar levels low.
Okay. this is another article that talks about something that has happened in the last 10 to 15 years. CAR T cell therapy turns 10 and finally earns the word cure. CAR T is a type of cellular immunotherapy that has cured cancer. And it is therapy in which they take your cells and they treat them outside of the body, then return them to the body. And with this treatment, they're able to get your cells to kill cancers. And this then is something that has happened over the last 10 years for certain cancers. This along with other cancer therapies have made a difference in breast cancer survivals. And this talks about one patient who 10 years ago had the first treated and now has not had recurrence in the last 10 years. And this is because the T cells were modified outside of the body and then given, and this has been effective in treating a number of patients with leukemia and other cancers. It's not only for leukemias, but it's also for other cancers. So this is all part of the new type of precision medicine that allows cancer to be cured in many circumstances. I don't know how many of you had heard about CAR T cell therapy, but it certainly has been remarkable therapy in terms of curing actually cancer that were lethal before.
That's great.
Any comments about this and that?
Is that similar to the process of Chris hurt his leg a year ago, injured his knee from a fall. And when he went to the doctor, oh, it's going to be a long time healing. They didn't want to operate. He eventually went to another doctor. They said the same thing. And then finally they started the treatment where they drew blood, separated the platelets, and I think it was the platelets, and injected it back.
Yeah, that's different.
Okay.
Because that's just platelet therapy.
Okay.
Yeah, but platelets have healing factors in them.
Mm-hmm.
And so they take out the platelets and they infuse the platelets into the areas, and that speeds up the healing.
And it worked, yeah.
Yeah, it speeds up the healing. Whereas this is different in that this takes your cells and treats your cells outside of the body.
Mm-hmm.
And then your cells outside of the body develop cancer curing or cancer killing cells that go back into your body and kill the cancer. So, so it's very different from platelet transfusion, which is your own platelets that are used to accelerate the healing.
Mm-hmm.
Any other comments about the CAR T cell therapies? It's, we've talked earlier about gene editing, and we started that talk about 5-6 years ago, and they eventually won a Nobel Prize for that. And now CAR T cell therapy is also likely to result in a Nobel Prize for the people who developed that. Now, monkeypox is an interesting version of another virus. The difference with this virus is that it's not, we talked about it last week, it's not associated with aerosol. It's actually associated with hygiene and cleaning. The one thing about this virus, though, is that it's all by transmission, and so far 98% of the people who have monkey pox are men who have sex with men, which made it perhaps made it difficult for people to recognize it's something that's important, because we have a lot of people, a lot of men who have sex with men. So it's something that is true all over the world. And so it's spread. So far, 98% involved men have sex with men. That doesn't mean it's only them, because if you come in contact with anybody who has these lesions, then you can get the virus by that way. So this is, they've had 122 cases already in DC, and they have a number across the United States. I think the last statement I read was that they have more cases in the United States than anywhere else in the world, although Australia and France and other places have it as well, but we have more here. And this talks about the fact that when there was disagreement among the experts, that the World Health Organization, TEDROS, decided to declare it an emergency, even though it was not unanimous. So. And it's something that's going all over the world, so it's appropriate.
Dr. Callender, monkeypox, is a world of difference between that and chickenpox?
Yes, yeah, different viruses. That vaccinia virus is the virus of chickenpox. So it's a different virus. Yeah. But of course, chickenpox can be transmitted by aerosol as well as touching it. So it's probably, chickenpox is worse.
Mm.
Yeah. Okay, this is shows that it reports again that the United States is the leading country with monkeypox, and the greatest prevention is gloves and washing your hands.
No more fist bumps.
So anyway, it's good to know about monkeypox as well as all the other viruses that threaten our existence. Oh, this is an article that I wrote to our church that talks about the BA.5 variant, which is hyper contagious and is increasing hospitalizations and ICU admissions. So far, there appears not to be a higher death rate. But among the unvaccinated, the variant is 5 times more likely to get infected than vaccinated. However, among the unvaccinated, 7.5 times more likely to be hospitalized, 14 times more likely to die to get infected. So the issue is that it's evolved to be more contagious and to evade the immune protection that people had from an infection, vaccination, or both. So whether you've been previously infected or vaccinated, you have very little protection from this virus. And so you're likely to get mild to moderate infection. Now, if you are vaccinated, you do have a good protection against dying or being hospitalized or ending up on a ventilator. So that's the protection you get, but it doesn't keep you from getting infected though. As you can see with this infection being in with the president and many others. And the best protection is having been vaccinated and having had all the boosters. Now, next is the KN95 or N95, KN94 and N95 masks are recommended when indoors or in crowded areas outdoors. Of course, when you look at crowded areas outdoors, you don't see very many people wearing masks. And this is a cause of concern. And then as with the president, when you get this infection, there's treatment. Antiviral medications like Paxlovid are now available, which we didn't have before. So we've come a long way now. Now, this virus is different in that it doesn't affect the upper respiratory tract, the upper airways, but it infects the lung. And so getting coughing is one of the first symptoms of the disease. And two doses of the Pfizer vaccine are 80% effective against hospitalization from the BA.5. And then the last suggestion is that improving ventilation by putting indoor air purifiers is beneficial, and home testing, if you've been exposed, is recommended. Any other comments or thoughts about this variant of coronavirus, which we're dealing with and will continue to deal with? And then, of course, we know that Biden tests positive, and he's improving well with it. He's had Paxlovid and seems to be responding to it, unlike Fauci, who had a rebound phenomenon with it. But he seems to be doing well. He's 79. So, any comments? If not, we'll go to the next one.
He tested negative yesterday.
Yeah,
Oh, congratulations.
No, I said Biden tested negative yesterday.
Oh, I thought you said you did.
yeah, they are. We have a National Medical Association meeting in Atlanta next week, and they're requiring at Morehouse that you get the same thing that you guys did at Kennedy, that you have a negative PCR test before you get in there, regardless of whether you had a booster or not. So things are really getting interesting. Because in DC, that's not required, but in Atlanta, Georgia, it is. And this talks about the benefits and risks of Paxlovid. We see that the president fell into the high-risk category that we have, being over 70. And he was well boosted, but he still got the infection, still required the Paxlovid, but responded well. And we were reminded that the purpose of the vaccines are to prevent the need for hospitalization or ICU or death. And so far, the boosters are accomplishing just that. So anyway, so far, this is held up, and so the best prevention is to be boosted. And so now the reason that Biden had to stop his go down, go back up, right here, right there. The reason that Biden had to stop his medication is that atrial fibrillation is irregular heartbeat that increases the risk of heart attack and strokes. But this is a conflict with cholesterol lowering medications and Eliquis. So he had to stop those medications for a brief time while he was taking the Paxlovid. And then so once he gets over it, he'll go back to taking those 2 medications. And this is just to point out that wearing that mask and 94 K95 works, but if you don't wear it, you can get infected, reinfected COVID. And there are people who have had COVID 3 times and more. So we have to be ever cognizant that we need to be masked appropriately in certain locations, especially indoors. And
Dr. Callender, I saw an advertisement that sort of explained the virus to me quickly. It was 2 pictures, and it reminded you of the tumbleweed. You know how the tumbleweeds travel, and so it showed a picture exactly of how the molecules of the COVID-19 travel. It's the same in the air. It's the same, except it's not on the tumbleweeds are on the ground, but the COVID-19 virus covered the whole atmosphere.
okay, sounds
That sort of gave
great.
me a great understanding of it.
Okay, great. Okay. Anybody have any questions about in fact, I think someone had mentioned that they had somebody that had 3 COVID infections. And,
Yeah, I had a neighbor
yeah,
had it twice and still can't smell or taste.
yeah. Long COVID, right.
So Dr. Callender, do they know what's the deal with the people who get reinfected? Is it something different about them as opposed to everybody
Well,
else?
no. And well, of course, with the new variants, that's the rule rather than the exception. The variants are part of the problem in terms of with the virus changing so much. This allows, for example, as you have the variants, this variant is hyper contagious. So it's not so much the person as it is the variant.
Dr. Callender, my roommate recently got COVID. He's been vaxxed and boosted. And he described his particular symptoms as a deathly pain in his mouth. So I guess it would be similar to an abscess, to the abscess pain. But he said in this particular case, it wasn't isolated to a tooth necessarily, but like he had just an excruciating pain in his oral area, his mouth area, that he had to take Percocet and some more pain meds just to try to subside it. But it was very ghastly to him. Any thoughts about how the location of COVID pain and symptoms? Have you heard anything like that?
No, as a matter of fact, most of the BA variant spares the upper nose. This is the first case I've heard that it involved the mouth itself. So no, I wasn't aware of that. And we know that the nose is spared, but I didn't know that the mouth was a particular site of symptoms.
I thought the first symptoms was a sore throat with this
Sore
new
throat,
variant.
yes. Sore throat. Yeah.
Okay.
Sore throat. But he said mouth. That's a little.
Okay.
Did you mean, Mark, you meant mouth, right?
Yeah, that's what he described to me. Yeah, was his mouth area. Again, similar to the pain of an abscess, but again, it wasn't localized to to the gums or anything. Just the mouth area. But that's what he
Yeah.
described, yeah.
That makes it different, yeah. Sore throat is common, but mouth, I've not heard of before.
Dr. Callender, do you think that this is just gonna be an annual thing? We're gonna be getting COVID shots
Yes,
annually and boosters?
yes, yes, I do.
Okay.
I
Yeah.
think one of the most important thing, Dr. Callender,
Okay, because I've been giving them to her.
Well, who's speaking?
okay, this is Elizabeth. Dr. Callender, one of the most important thing that I tell the clients that I work with is that you must keep your immune system built up. That's just my opinion, but that's one of the one thing that I encourage. Keep your immune system built up.
Okay, Joyce, were you trying to say something? Joyce, were you trying to say something?
I'm sorry, no, I didn't realize that my mute was not off. I'm sorry.
Oh, okay, all right, okay. Well, saying keep your immune system built up is a good advice. The question is, how do you do that? And I think one of the nice things about the booster is that it keeps your immune system to the point that you don't have severe hospitalizations or deaths. So that's all, again, part of keeping your immune system up is being vaccinated and having boosters every 6 months or so. Then they're talking about this question in a way it's a little different from what Buchanan had asked. That is that some people don't get BA5 and some people do. And so far, we don't know the answer as to why it is that some people just don't get anything. For example, the data indicates that 70% of all Americans have experienced COVID. So what is it about the other 30% that allows them to escape? And you could include a variety of reasons, but it hasn't really been identified. And this is some of the theories about the genes that affect the ACE2, which allows the virus to get into the cells. And so, and also the interferon as well. And so it may be in the genes, but we aren't sure yet. The T cells seem to me to be also an important factor, because it seems to me that the one thing that the vaccines have done is alerted our T cells. And even when the antibody titers are not so high, the T cells are able to, and that's what Elizabeth is talking about when she says, keep your immune system up, because the T cells are the part of the immune system that fights off viruses, even when the antibody titers are not high.
Dr. Cullen, I have a question. You know, when you're having surgery, you know, doctors warn you that the risk of infection. And so when you're going through surgery and there are risks for infection, is it because the surgery lowers your immune system, or because your body is open to invaders? And last question is, would these viruses be part of that invasion?
Well, I think there's a combination of factors. Surgery does lower your immune system, but also the fact that you're in a hospital where people are and they carry their own infections if they don't wash their hands appropriately. And so it's a combination of factors, the surgery itself and the fact that you're exposed to people who haven't necessarily wash their hands, and so hospital-acquired infections occur as a consequence.
Well, are the infections coming through the site of the surgery or through oral cavities, or how does that happen?
Well, there's evidence that brushing your teeth will prevent some of the pneumonias that occur. And so brushing your teeth is one of the things that you can do. And the other thing is to make sure that all members of the healthcare team wash their hands before they interact with you. This is a studies, and you see studies all over the place saying this and saying that, and I think it's pretty clear that it did come from bats, other animals. So I don't, although it's a theory, it's pretty well established that it didn't come from outer space. It came from other species. Which other species? That's where the question comes. Is it bat, or is it other wild animals? And the bat seems to be the most common hypothesis, but xenozoonosis is something that's been with us for quite a while. That is getting infections from other animals, from different species, and that is probably the most likely theory, that it's xenozoonosis. And I think this is just another study that points out that it's the hypercontagious aspect of BA.5 that is creating havoc with all of us. And right now, the BA.5, and there's another variant that's cropping up, but right now, BA.5 is the one that is dominant and is infecting and reinfecting many people.
Dr. Callender, did they determine which variant that Biden had?
The presumption is BA.5. I don't know.
That's what they said, BA.5.
Yeah, that's the presumption. Most people who get infected, 80% of the infections in the United States are from BA.5.
Can you actually have COVID and not have any symptoms at all?
Yes. Well known, yes.
Dr. Callender, can they test you to find out if you've had COVID and recovered?
Yes, they can. They have antibody tests and T-cell tests that can identify that.
Dr. Atto, I don't know if you know, but your camera is on right now.
Now, this is interesting. They had the first polio case since 2013. And since we thought it had been eliminated, a lot of research to try and find out where it came from. In New York, of all places. And you see, it came from a 7-month-old who had recently moved to the United States from India. So this is interesting to see what happens from this one case for a disease that we thought was completely eliminated. So we'll have to watch and see what happens with this case. See what, yeah.
How is that spread?
The polio virus?
Yeah,
Yeah. I believe I haven't studied it in so long. It says hand to fecal. That's what they set up above hand to. Yeah, hands contaminated with fecal matter of an infected person, or by oral to oral or respiratory contact. So once it starts, you have to watch out for that. Until you have to isolate those people. Since our people are routinely vaccinated against polio, so it would be alarming if it occurred in somebody who was already vaccinated.
So the polio vaccine lasts forever? Is that what you're saying? Once you're
Yeah.
vaccinated?
Mhm. That's the expectation, yeah. Well, because of the climate issues, this may be one of the hottest summers, we think. Although when we talk about heat, it pales in comparison to what's going on in Arizona, but it's still pretty hot. What is your thermostat set at?
Right now,
Huh?
77.
What number?
Mine is 77.
77. Oh, okay.
76.
This is
78,
78, the magic number.
78, mine's at 78.
Yeah.
Ours is at 78.
Yeah.
This article talks about last year.
No, this is this year.
Yeah, they said that this year, I heard, but
That's what it said.
I'm
Yeah.
looking at the top of the article.
It says 78. Yeah.
I know, I'm talking about the date of the article.
Ah,
yeah, but they also said it this year. I heard it just the other
Yeah,
day.
but
78.
if you add global warming in there, then we're gonna have to get cooler every year inside the house.
Well, we'll see. We'll see. I hope you're wrong, but most people think you're right.
last week on TV, they were saying 70, and that's freezing for me.
Oh, me too. Yeah.
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 It's perfect for me.
Yeah.
Yeah.
Well, it's interesting if you look at your bill to see how much it costs to
Yes.
do it. Yeah.
And stay hydrated.
Yeah, that's the other thing. Right.
Especially during the summer.
And we also don't want to forget to change our filters because that also helps to circulate the air.
Yeah. Mhm.
Yes. Yes.
Mhm.
I even changed all the vents in the house 1 year.
Oh, mercy, good.
And you'd be surprised when you put in new vents and look at the old vents. But my house is as old as I am.
What vents are you talking about?
You know, you're in and out.
The filters.
The
No,
registers, the
vents,
registers.
the in and
The registers.
no, the vent where the air comes out
In every room.
Yeah.
in every room.
Yeah.
You got a in and you got out, right?
You can't just paint them.
Damn.
Well,
Don't you have to unscrew? Don't you have to unscrew those things to get to the vent?
I did the Sears vent too. I did the Sears vent as well. Where the Sears come in and clean all your vents. I did that as well. And that proved that I didn't have a lot of things in the vent. And then I was trying to figure out as the reason for this 70-year-old house as to why the heat and the air wasn't coming through, but the temperature says one thing, but the air. And so I went to Home Depot to get some new vents, and an older man told me, he says, "You're buying new vents?" I says, "Yes." And he says, "You're gonna get better circulation." And he was absolutely right.
Well, could you come over and show me what you're talking about? I have no idea what you're talking about. I mean,
You don't have vents? You don't have vents?
yeah, I got vents, but I don't know what to do with them.
Oh, okay.
I see them up in the wall. There they are. Whoops, there it
Well,
is.
some in my house, they're on the floor. Some are in this. I mean, it depends on what the house is, how they're made, what it is.
And how old
And
is
you have
it?
to, yeah, and my house is old as I am. It's in
You
the
actually-
70s.
You're actually talking about the metal vent.
Yes, yes. And you'll be surprised once you pull out the old one, you know, what those old ones looks like. And the difference between the new, the difference between the output and the input when it comes to those new ones. It was surprising.
Okay.
I had a difference. I had a difference when I changed my filter,
Yeah.
because they said change your. I was changing my filter every 3 months, but now I do it every 2. It made a lot of difference.
Oh, okay.